Welcome once again to my channel. Today we are going to look at the part 2 of the care plan as we started last week, and then this is the care plan itself amounting to 12 marks, right? We have your nursing diagnosis, which is 1 mark, your objective stroke outcome criteria 1 mark, nursing orders 1 mark, then nursing intervention 1 mark. The evaluation has no mark but it needs to be filled. Right. So with this normal examination setting, we should have this divided into 4. Technically, 3 will give you 12 marks. But you having a fourth nursing diagnosis and a complete care plan will give you an upper hand if one of the other 3 are having issue, and then the fourth one has an adequate mark, can stand in for one of the 3 above. And mind you, the nursing diagnoses are driven from your patient problem that you had in your first page, right? And it should be in order as it's been arranged in the first page. Good. Even though sometimes errors can occur and can get jammed up, but try as much as possible to be able to make it arranged. Alright, so we are going to use the example here as a guide to help us get oriented on how to fill this side of the care plan. So you have your date written perfectly as well as your time, even though it has no mark but it's relevant. Now you go to your nursing diagnosis. The nursing diagnosis is 1 mark, right? So you derive this nursing diagnosis from your patient problem. So if your patient problem, which is the first problem, is that patient says into quotes, I cannot sleep well at night, or your problem is patients cannot sleep well at night. Good. Come up with your nursing diagnosis. Sleep pattern disturbance, insomnia related to change of environment. That's your nursing diagnosis. Your 1 month is secure. Your 1 mark is secured. Right. Then you go to your objective stroke outcome criteria. You have patients who regain a good night's sleep over the period of hospitalization, as evidenced by 1. Patient verbalizing she had a sound sleep at night. Then 2. Nurse or night nurse reports indicating patient had a sound sleep at night. Good. Then now go to your nursing orders. We have 1. Assess patient sleeping pattern. 2. Encourage patient to avoid heavy meal and coffee before bedtime. 3. Encourage patient to avoid excessive fluid intake before bedtime. 4. Encourage patient to take bath before bedtime. Then discourage patient from flirting, worrying, or focusing throughout the night that will keep her awake all night. And then 6. Reassure patient and relative. Right, so your nursing orders are plain and then directed forward as an order. But the intervention might look like a rationalized order or a pass order. So looking at your nursing intervention, which is 1, patient sleeping pattern was assessed, not assessed. And then with a little bit of rationale, flare this one. We're noting the quality, depth, length, bedtime routine, and posture as a baseline. Then you can have 2. Patient was encouraged to avoid heavy meal, because the word encourage is key here, and cafe before bedtime to avoid delay in sleep onset. Then the 3rd, patient was encouraged. So you are looking at encouraged, not encourage. So you can either write patient is encouraged to avoid excessive fluid intake before bedtime. You are okay. But to add a little bit flair, a rationale is added to it to avoid frequent urination and uninterrupted sleep. So this varies and goes on with each and every nursing order here. We are good. Then you go to your goal fully met, as evidenced by 1. Patient verbalizing she had a sound sleep. So it's patient verbalized she had a sound sleep. Night nurse report indicated that patient had a sound sleep. That is for the evaluation. With this, you are done with your first slot of your nursing care plan. Then you move to the next one and you move to the next one. So this is how you present a full completed nursing care plan. So over here I have a bit of assignments down. We have the date set and then nursing diagnosis set. So here the problem is patient has a high body temperature and then the diagnosis is hyperthermia 38.5 degrees Celsius related to inflammatory process of the condition. We have our objective stroke outcome criteria being listed here and then the nursing orders. So have your time and try and then put these nursing orders into intervention and evaluate on your own to actually put a notice that you really understand what has been explained above. The same apply to this one as well, where the date is set and then the nursing diagnosis, which is from a problem. Patient complain of lower abdominal pain. Nursing diagnosis acute pain in the brackets lower abdomen related to inflamed small intestine. The objective stroke outcome criteria has been made, so as are the nursing orders. So come up with your own nursing intervention and then see what's next. Thank you for your time. God bless you. Bye bye.